Patient safety is one of the most crucial aspects of the medicine field. It is a global public concern which aims to save lives, and those who are at risk can also be saved. According to World Health Organization, patient safety is the absence of preventable harm to a patient during the process of healthcare and reduction of risk of unnecessary harm associated with healthcare to an acceptable minimum. Meaning there is a borderline between who to save or what kind of patients or cases to be saved or can be saved with the aid of patient safety. An acceptable minimum refers to the collective notions of given current knowledge, resources available, and the context in which care was delivered, weighed against the risk of non-treatment or other treatments. So, in cases where there are no available treatments or preventions that the doctors can no longer prolong the life of the patient, then it is not considered killing someone. But in patient safety, there are cases that are totally preventable with just proper handling and good communication between the patient and the physicians and the other healthcare professionals. Additional information about patient safety. It is fundamental to delivering quality health services. Indeed, there is a clear consensus that quality health services across the world should be effective, safe, and people-centered. In addition, to realize the benefits of quality healthcare, health services must be timely, equitable, integrated, and efficient. So, patient safety, from the word itself, patient safety, patient meaning it should be patient-centered or people-centered. In order to treat diseases effectively by physicians, the patients should communicate effectively with the professionals in order to give the proper medication and treatment for that specific patient. The patient safety barriers that the world is currently facing are healthcare-associated infections, antibiotic resistance, personal protective equipment protocol, medication errors, and transitions of care. The first one is the healthcare-associated infections. These are infections that people or patients get while they are receiving healthcare for other conditions. For example, you went to the hospital to get a checkup for your current disease or condition or impediment, and then after that you are admitted to a certain portion of the hospital where there is COVID-19, and then you acquire COVID-19 in the hospital. That is what we call healthcare-associated infections. Next one is antibiotic resistance. Certain bacteria and fungi develop the ability to defeat the drugs designed to kill them by patients taking antibiotics when it is not necessary. So this one is very alarming because nowadays our antibiotics are losing their effectivity to fight specific diseases or pathogens. If this continues, the scientists or the healthcare professionals that are capable of doing said antibiotics will no longer come up with a new antibiotic for a very long time, and that would lead to another pandemic because we cannot already fight the diseases that are attacking our body with antibiotics. Next one is the PPE protocol. Some healthcare workers tend to neglect the importance of PPE in the workplace, especially in critical areas of the hospital. For example, you are in the laboratory and you are handling specimens. that are very infectious like stool, urine, and blood. Some healthcare professionals tend to neglect the possibility of acquiring said diseases from the specimens by not following the proper PPE protocols, which are wearing masks, wearing face shields, wearing gloves, and a scrub suit. Without any of these, the possibility of infection can occur. Next one is the medication errors. Miscommunication between the physicians and other healthcare professionals that lead to inaccurate disease diagnosis and treatment. Patients, when scared, tend to change the history of their disease. For example, the doctors are trying to investigate on a said disease on a patient, which can be tuberculosis or worse, cancer. If a patient tells the physician that he or she was not smoking, or he or she hasn't undergone any medication before, that could lead to miscommunication that leads to improper diagnosis. So instead of treating the disease, the physician is actually worsening the disease of the patient. Next one is transitions of care. This one is very vital in the medical field in cases of emergency. The ineffective movement of a patient from one setting of care to another could lead to death even before the patient gets to the hospital for immediate treatment.
Next is patient safety concerns worldwide. So ang first ay United States of America. Maternal health of patients as teenage pregnancy cases rise to be one of the country's major concern. In the United States, maternal health was number 2 on the list of ECRI's patient safety hazard in 2020. Next country is Brazil. Underreporting of cases in its national health organization that leads to inaccuracy in disease prevalence. In Brazil, more than half of the incidents were reported as AE, which means adverse effect. In Tagalog, masamang epekto in registered hospitals. For example, sa 109,802 na incidents na ni-report, 75,088 ang adverse effect with 649 deaths. Kaya importante talaga ang accurate and maayos talaga yung mga report. Next is New Zealand. Risk adjustment in patients with chronic illnesses affecting hospital funding in other patients. Third is United Kingdom. Death toll on patients that had avoidable disease and complication neglected due to the pandemic. This happened in the United Kingdom because of lack of patient safety and care. They should devise a strategy or method na ma-handle itong mga dilemma na to. Especially ngayon na may bagong strain ng COVID doon. The last is China. Lack of communication openness between the patient and professional and a perception of penalty for hospitalization. Good communication is key to properly function environment, lalo na sa mga hospitals. Next is importance of patient safety. Bakit nga ba importante ang safety ng ating mga patient? It helps protect patient and creates an environment where better overall care is possible. Patient safety protocols can reduce medical mistakes and prevent adverse patient outcomes. It is important to work to protect them for unintended or unexpected harm. Teamwork, good communication, and series of checks to prevent mistakes are some of the ways healthcare organizations can promote patient safety. Hospital-to-hospital partnership can also help improve quality of care and patient safety as they work together to increase patient safety learning and development solution. According to World Health Organization, occurrence of adverse events due to unsafe care is likely one of the 10 leading causes of death and disability in the world. And each year, 134 million adverse effects occur in hospitals in low and middle income countries due to unsafe care, resulting in 2.6 million deaths. That is why patient safety is very important. Importante ito para maprotektahan natin yung ating mga pasyente. Halimbawa, pag may mga report na mali, communication is key. Kailangan mo i-report ito sa head mo para hindi ka mamali na sasabihin sa mga patient mo. And also, teamwork and communication is a key para iwasan yung mga miscommunication and maagapan agad yung mga mali. And also, ang important ng patient safety para ma-inform din yung mga patient mo na kung anong ibibigay mong gamot, anong gagawin sa kanila, anong sakit nila, at paano nila ma-overcome ito. Next is patient safety in the Philippines. The patient safety culture is a highly acknowledged and is considered as a critical component to the quality of healthcare in the country. Teamwork within units of 91.50%. Teamwork is important, especially in the healthcare environment. Kasama na dyan yung good communication from coworker to coworker, or for example, medtech to doctor, to maintain continuity of care for patients. Especially sa mga medtechs, communication is key para ma-avoid yung mga mislabeling at miscommunication sa mga specimen at pati sa mga coworkers mo. Next is organizational learning, continuous environment, which is 86.89% here in the Philippines. Health workers should understand the multiple factors involved in failures and correct it para mas ma-develop pa yung ating characteristics, physical or mental. Next is non-punitive response to error, which is 17.65%. This is important because we should held accountable for our mistakes and avoid the blame game. Reckless behavior should not be tolerated in hospital environment. Kaya important talaga ang good communication para ma-sustain yung safety ng culture ng ating pasyente. Then last is overall patient satisfactory of hospital to nurses, which is 45%. Ito ay importante din kasi dito din nakasalala yung parang review ng hospital mo. Kasi dito mo malalaman kung satisfied yung patients sa service ng hospital, and it will determine the responsiveness of hospital staffs, cleanliness and quietness of the hospital environment, and etc. There are tips to improve patient safety. First is use monitoring technology to verify medical staff compliance. Second is make sure patients understand their condition and treatment. Importante ito para ma-aware at maintindihan ng ating mga pasyente kung anong treatment plan ba ang gagawin sa kanila. Then third is follow all hand washing procedures prior to having contact with the patient. This is important, lalo na ngayong pandemic. Kailangan natin ng proper hand washing before contact with the patient to avoid and prevent the transfer of disease and infections or germs. Next is verify all medical procedures before doing anything. This is to avoid ng mga pagkakamali and to clarify yung medical procedure na gagawin kay patient. Next is always promote team atmosphere in workplace. Good relationship in workplace is important because it will increase the person's morale, and this will also makes work more fun for the employees to have overall positive environment. Next is engage in communication with the patients and their family. Effective communication and collaboration with patients and family members affect patient outcomes, patient safety, and perceptions of quality. Pag feel ni patient na involved siya dun sa gagawin mo, dun sa para sa health nila, they will be more likely na mag-engage and to follow the treatment plan na inihanda ng doktor nila. And ang result nito ay di positive clinical outcome magiging. So, next is patient safety significance to society. Cost efficient. Practicing proper patient safety protocols can lessen the waste of medical materials, medication, and time spent in each patients. Next is prevent antibiotic resistance. Na tayong mga Pilipino, mahilig tayong self-medicate, lalo na pag may lagnat lang tayo, iinom tayo ng antibiotic. Pag continue natin ito nang walang tamang proper information and proper na reseta sa doktor, magkakaroon tayo ng antibiotic resistance. In the future, pag nagkasakit tayo, mahirapan lalo tayo matreat yung sakit kasi resistance ka na doon sa existing na gamot ngayon. Lastly is saves more lives. Ang example nito ay katulad ng mga nurses at talaga sila hands-on talaga sila sa mga patient nila para ma-attend talaga yung mga pangangailangan nila and ma-discharge agad yung mga pasyente ng maaga. That's all. Thank you.